A mental disorder like depression can have severe consequences. This video will show you what warning signs to watch for and how doctors reach a diagnosis of clinical depression. In the end, you will know what exactly qualifies as major depressive disorder. Warning: signs of depression. Even though depression symptoms can vary from person to person, for most people, their ability to perform daily activities and social life is affected to some degree. The following are warning signs of depression to watch for. Sadness. A feeling of sadness or emptiness that lasts for more than 2 weeks is most common. Worthlessness. It is the continual feelings of worthlessness, guilt, or helplessness. Individuals fixate on personal shortcomings or past failures. They always feel it is their fault whenever bad things happen. Irritability. Individuals get easily frustrated or angered for seemingly small things. While women tend to be angry or tearful, men are more volatile or aggressive. It is probably because depressed men are frustrated by their inability to get things under control. A depressed man may show these symptoms. Irritability. Risky behavior. Substance abuse. Misplaced anger. Fatigue. Lack of energy or feeling tired all the time is a typical symptom of depression. It may lead to poor personal hygiene, oversleeping, and isolation at home. Guilt. Self-blaming becomes the norm. People experiencing depression feel everything is their fault. Crying spells. People with depression may frequently cry for no apparent reason. Apathy. Depressed people lose interest or stop finding pleasure in activities they once enjoyed. For example, sports, hobbies, social with friends, sex. Anxiety. Depression can cause a person to feel anxious all the time without justifiable reason. Symptoms of anxiety can include feeling nervous, restless, or tense, having a sense of impending danger, panic, or doom, having an increased heart rate, breathing rapidly or hyperventilation, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than the present worry. Restlessness. Restlessness and agitation may occur with depression. Typical signs are pacing, an inability to sit still, or hand-wringing. Lack of concentration. Remembering, maintaining focus, or making decisions may become impossible. For example, students may experience a sudden drop in grades due to a lack of concentration. Withdrawal. Depression often causes people to isolate themselves from the outside world. They don't answer the phone, stop contacting friends, and refuse social interaction. Sleep problems. Sleep disturbance is common. It could be a lack of sleep or oversleeping. Overeating or loss of appetite. Some may lose appetite and experience weight loss. Others may overeat and gain weight. Thoughts of suicide. Suicide is a serious problem of depression. If you or someone else is having thoughts of suicide, seek immediate medical attention. Physical pain. Sometimes depression can show up as a physical symptom, such as headaches, cramps, digestive problems, chest pain, muscle ache, trembling, hot flashes. If these physical ills occur for no apparent reason, depression is likely a cause. Procedures to diagnose depression. If you have a few of the above symptoms, you will need to see your doctor for further assessment. Your doctor will likely follow the following procedures to reach a final diagnosis. 1. Rule out other causes of symptoms. When you seek medical advice, a doctor generally performs some investigations to rule out other causes first. Blood TSH and thyroxine for hypothyroidism, low thyroid function. Electrolytes and serum calcium for a metabolic disturbance. Full blood count for a systemic infection or chronic disease. Testosterone levels for hypogonadism, low sex hormones. Low levels of vitamin D. Cognitive testing and brain imaging for dementia. CT scan for brain disease. Your doctor will rule out medication side effects or alcohol misuse as well. No biological tests can confirm clinical depression. 2. Perform psychological assessment. If other causes of your symptoms were ruled out, depression is suspected. Doctors may ask in-depth questions about your mood, behavior, and day-to-day activities. They will also ask about the psychological history of your family. Then you may complete some depression rating questionnaires. Examples are Beck Depression Inventory. BDI comprises 21 self-reported questions. They assess the mood, symptoms, and behaviors of people who are depressed. Hamilton Depression Rating Scale. HDRS is a questionnaire designed to determine the severity of depression. It also consists of 21 questions. Each relates to a particular sign or symptom of depression. Higher total scores indicate more severe depression. Zung Self-Rating Scale for Depression. The Zung Scale is a screening tool assessing the level of depression. It is a 20-question test with a score range from 20 to 80. Most depressed people score between 50 and 69. 3. DSM and ICD criteria. After the doctor has gathered enough information from the psychological assessment, they will use diagnostic standards to reach a conclusion. The most widely used criteria for diagnosing depressive conditions are Diagnostic and Statistical Manual of Mental Disorders, DSM, of U.S., and International Statistical Classification of Diseases and Related Health Problems, ICD, of WHO. The DSM-5 criteria include 9 potential symptoms of depression. Feeling depressed throughout each day on most or all days. Lack of interest and enjoyment in activities you used to find pleasurable. Trouble sleeping or sleeping too much. Difficulty eating or overeating, coupled with weight gain or weight loss. Irritability, restlessness, or agitation. Extreme fatigue. Unwarranted or exaggerated feelings of guilt or worthlessness. Inability to concentrate or make decisions. Suicidal thoughts or actions, or thinking a lot about death and dying. To reach the final diagnosis of major depressive disorder, the patient must meet all these criteria. 1. 5 out of the 9 specific symptoms listed above. 2. At least one of the symptoms should be either 1. Depressed mood or 2. Loss of interest or pleasure. 3. Must frequently occur for more than 2 weeks. 4. These symptoms must cause impaired functioning in social, occupational, or other vital areas. A quick reminder, this video is for information only. Please seek medical advice from appropriate healthcare professionals. If you liked the video, give it a thumbs up and share it with your friends. Comment below to share your understanding of the diagnosis of depression. Please subscribe to our channel. Your support means everything to me.